Assalamualaikum warahmatullahi wabarakatuh. My name is Nurul Fazlin binti Azman. Today I would like to representing to Prof about the mammography, MRI or ultrasound for breast cancer, screening for breast imaging in high-risk young women. So this is my scenario. Sophia, 28 years old, performs breast self-examinations at an yearly age because she has a family history of breast cancer. She went to the hospital for a medical screening one day. Sophia's doctor advised her to have an imaging screening, but the doctor was unsure whether a mammogram, MRI, or ultrasound would be a more sensitive and better diagnostic modality for a young person like Sophia. So what is the breast cancer? Breast cancer develops when healthy breast cells become abnormal, grow uncontrollably, and form tumors. So cancer that has spread cancer that has not spread is referred to as in situ, which mean in place. Cancer that has spread is referred to an invasive or infiltrating cancer. So this is the breast cancer that I found in a journal. So this is the pictures or image for breast cancer. So breast cancer is a disease in which the cells in the breast proliferate uncontrollably. There are various types of breast cancer. The type of breast cancer is determined by which cells in the breast develop into breast cancer. Breast cancer can start in any part of the breast cancer. So this is the kind of breast cancer: invasive ductal carcinoma and invasive lobular carcinoma. For the invasive ductal carcinoma, the cancer cells begin in the ducts and then grow outside of the ducts into the other parts of the breast tissues. Invasive cancer cells can also spread or metastasis to the other parts of the body. So for the invasive lobular carcinoma, cancer cells begin in the lobules and then spread from the lobules to the breast tissues that are close by. These invasive cancer cells can also spread to the other parts of the body. So risk breast cancer, the first is dense breast, and the second one is having breast cancer before, heavy alcohol use, inherited gene mutations, smoking person, older age or older woman, overweight or obesity, and the family history of breast cancer. So this is the comparison of modality of choice with other modalities, which is mammography, MRI, and ultrasound. For the mammography, mammogram are used as a screening tools in women who have no symptom of breast cancer. And the MRI is a medical imaging technique used in the radiology to create image of the body's anatomy and the physiological processes, and that uses the magnetic field gradients, and a radio wave. So in ultrasound, a technique that uses high energy sound wave to examine tissues and organs within the body. Sound wave create echoes which form image of tissues and organs in the computer screen. And it's also known as ultrasonography. And this is the formulating of focus questions, which is the PICO. P, which is the populations, young woman under 40 years old with high risk, or maybe under 40 to or 35 to 40 under 35 also can. And for the intervention use is the mammography, and for the comparison is MRI and ultrasound. For the outcomes is the best modality in screening of breast cancer. Focus questions between the mammography, ultrasound, and MRI. Which one is better screening at identifying breast cancer with high risk in a young woman? So this is the image sample of breast cancer, which is this is the breast cancer in mammography. This is breast cancer in ultrasound, and this is the breast cancer in MRI. So this is my search strategy, which is in PubMed. I use PubMed. The first thing is breast cancer, then I add and mammography and magnetic resonance imaging and ultrasound, and the last one and young woman. So this I got the search outcome is I got 134 total paper found. From manual searching, I was not found any paper, and I was selected I was select 4 papers from 134 total paper. So the 70 paper was rejected due to irrelevant and insufficient quality. 40 papers topic not related to questions, and 20 papers not in English language, which is other from the English language. So I just select 4 papers. For the inclusion and exclusion criteria, for the inclusion contain young women populations, subject age between 18 to 30 or 35 or 40, then include mammography, ultrasound, and MRI modality only. For the exclusion, age below 18 years old, full text not available in English, and other than cancer screening. So this is the relevant journal that I use. Okay, this is the first journal. Journal of Clinical Oncology, and this is study type is diagnostic type study, and this is the outcome. 6 invasive breast cancers and 1 non-invasive breast cancer were detected among 196 high-risk women. So all 6 invasive cancer were detected by MRI. All were 1.0 cm or less in diameter, and all were not negative. So this is the first journal. For the second journal is BMC medical imaging. Okay, so the study type is diagnostic imaging. Outcomes, this finding confirm that DSG I is highly sensitive, and DSGI achieves sensitivity comparable to the MRI, to that of MRI for lesion more than 1 cm in size, while remaining superior to the mammography and ultrasound. This is the second journal. And the third journal is by the Journal of Clinical Oncology. Okay, study type is cohort study. Outcome, in the analysis modality, sensitivity was low for mammography, which is 33%, and ultrasound 40%, and the combination of both 49%. So MRI offer a significantly higher sensitivity, which is 91%. The sensitivity of mammography in the higher risk group was 25% compared to 100% for the MRI. So this is the next journal, okay, which is the South ASEAN Journal of Cancer, which is this study to investigate role of MRI in breast cancer management compared with mammography and ultrasound. So the study type is diagnostic study. Outcome, MRI is superior to X-ray mammography in high-risk breast cancer screening. Okay, it is also evidence that mammography with its lower sensitivity is limited in women with dense breasts. All right, so this is the comment. Mammographic screening has a low sensitivity for detecting tumors, particularly in BRCA mutations carrier. These women have a 21 to 65% lifetime risk of developing breast cancer. When dense breast tissue reduces the sensitivity of mammography, women who are genetically predisposed to breast cancer often develop the disease at a young age. So the American Cancer Society has issued guidelines for using breast MRI for breast cancer screening. This is the comment. And this is the conclusion. Finally, in these circumstances, breast MRI is recommended for screening women who are at high risk for breast cancer, typically due to a strong family history of the disease and or mutations of genes such as BRCA1 or BRCA2. So breast MRI is generally thought to be more sensitive than mammography for detecting breast cancer. However, it can miss some cancers that mammography would detect. However, breast MRI is only recommended in conjunctions with other tests such as a mammogram or ultrasound. So this is the reference that I use, and this one also. So yeah, thank you. That's all for me.